Krystal,
Indeed.
what are you taking a look at?
Well, guys, as you know, the pandemic has been truly awful in a whole lot of ways. In the U.S. alone, more than 800,000 people have died. The economy was ravaged, and now a surprisingly strong recovery in some ways has been hobbled by significant inflation. Our response as individuals and communities to the pandemic have been thoroughly politicized. Now we wear our ideological affiliations on our face with our masking choices. The discussion about vaccines is really one of the most toxic that I have ever seen. But we did catch one incredible break with this awful disease. It rarely severely impacts children. As of yesterday, per the CDC data, less than 0.1% of deaths from COVID have been kids under the age of 18. That amounts to 803 total deaths over the entire length of the pandemic. Now look, every child's life, of course, is precious. But we also have to consider that represents a tiny fraction of the overall number of pediatric deaths during that period. So COVID deaths are far less common for kids than death from car accident, death from drowning, death from suffocation, firearms, heart disease. They're even less common than deaths from the flu and from pneumonia. With Omicron, this trend, thank God, has continued. Just as in adults, Omicron is milder in kids than previous variants were. There's been an increase in kids who are hospitalized, yes, but that results from two simple facts. One, Omicron is just so incredibly widespread. And two, kids are much less likely than adults to be fully vaccinated. When it comes to COVID, at this point, we know very clearly the kids are all right. So it is absolutely inexcusable that we have continued to inflict widespread, well-documented, significant harm on our kids under the guise of protecting them from this pandemic. What do I mean by that? Well, major school districts across the country have once again shuttered, this time because of the Omicron wave. Places like Detroit, Milwaukee, Cleveland, Newark, they've all shifted back to remote learning to start the school year, to start 2022, putting their neediest kids at severe risk. It's not just those districts, though. You can see on this map that while, yes, the majority of schools are remaining open, all across the country there are districts switching to virtual learning. Red areas are in person, blue is hybrid, orange is remote. So you can see those patches everywhere across the country. There is no excuse for doing this to our kids. None. David Leonhardt over at The Times, he laid out the data pretty starkly here in a lengthy Twitter thread and accompanying article. He wrote, American children are starting 2022 in crisis. I'm not sure that many people fully grasp the depth of it. He details the catastrophic learning loss, spikes in mental health crises, and suicide attempts. New test results make it extremely clear that kids have suffered devastating learning loss, and especially poor kids. Performance on a national standardized test plummeted as compared with the pre-pandemic numbers. The fall-off was especially bad in majority Black and Latino districts. Kids learning to read and middle schoolers shifting from basic math to algebra, those were the people who were particularly impacted here. This matches results coming from places as disparate as Ohio, North Carolina, and Oklahoma, all of which have reported large drop-offs in math and reading proficiency. But this learning loss might not even be the worst impact. The psychological damage we've done to kids and to adolescents is only now coming into view. The American Academy of Pediatrics, they've recently issued a declaration of national emergency in child and adolescent mental health. As David Leonhardt also pointed out, suicide attempts have risen slightly among adolescent boys and sharply among adolescent girls. The number of ER visits for suspected suicide attempts by 12 to 17-year-old girls rose by 51%. From early 2019 to early 2021. That's according to the CDC. Teachers are also reporting large increases in behavioral problems, things from fighting, property damage, to kids just putting their heads down on the desk and refusing to engage at all. And as far as little kids are concerned, we still have very little understanding of how being cut off from socialization during a key moment of social development might impact them for their entire lives. Look, I really understand why parents and teachers would be very scared. The media has done a terrible job of communicating the actual risks of this disease, and specifically, the very low risk for children. Fear generates clicks, and reassurance does not. Or at least that seems to be the assumption of the mainstream press, although the fact that their ratings and clicks have fallen off a cliff might suggest it's time to reassess some of those assumptions, but I digress. David Leonhardt's own outlet has done its fair share of favor-mongering here, publishing multiple pieces about what has turned out to be a rare occurrence, long COVID in kids. This particular piece enraged me so much, I did a whole monologue on it titled, This is really scary. Kids struggle with long COVID. Lingering physical, mental, and neurological symptoms are affecting children as well as adults, including many who had mild reactions to the initial coronavirus infection. That's the one up on the screen right now. In fact, many kids did not struggle with long COVID. Research from the University of Minnesota found that fewer than 1 in 20 kids with COVID had symptoms lasting longer than 4 weeks. By 8 weeks' time, nearly all had fully recovered. I don't doubt that there are many well-meaning people who are freaked out by this COVID porn news, who truly believe that closing schools is the right choice to best protect our kids. But the science on this could not possibly be more clear. If you are closing schools, you are not protecting kids. You're hurting them. The only people who are protected by such decisions are the adults who refuse to get vaccinated. And if they don't care enough to protect themselves, why in God's name would we sacrifice the well-being of our kids to their benefit? I know districts will face challenges dealing with staffing shortages as adults call out sick with COVID, but it should be a national priority to protect our kids and at all costs stop sacrificing their well-being to the failures and neuroses of the grown-ups. And that is the thing, Sagar. At this point, it is inexcusable. And I've said it so many times. At the beginning of COVID. Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut. Our reactions to each other's monologues. You get to listen to it. You get to ask us questions. All that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.